Again, welcome to the first webinar of the Language Access Continuing Education series. Excuse me, my name is Susan Clifford, and I work as the Language Access Coordinator at the UNC Institute for the Study of the Americas in Chapel Hill. So now I would like to introduce two more colleagues from the North Carolina Department of Health and Human Services who will share information about the work being done through DHHS to support language access, interpreter trainings, and additional tips for supporting language access as interpreters. So we have Yazmin Garcia Rico here with us today, the Director of Hispanic Latinx Policy and Strategy at the North Carolina Department of Health and Human Services, where she leads cross-system strategies to meet the needs of Hispanic Latinx communities in North Carolina. During the COVID-19 pandemic prevention and response efforts, Yazmin led Spanish communication efforts to ensure culturally competent Spanish language communications regarding COVID-19 were available across the state. Since the end of the public health emergency, Yazmin has continued to lead efforts to increase language access across DHHS by working to ensure communications and other resources are available in Spanish in a linguistically and culturally competent manner. And we have Carolina Siliceo Perez. Carolina has held many roles within the community, from advocating for educational equity as a formerly undocumented student to working as an interpreter with the Sensontle Language Justice Cooperative. Her new role expands on 7 years of local government public service. She joined NCDHHS as the Latinx Project Manager in July of 2023. Welcome to Carolina and Yazmin.
Hi, everyone. I'm really excited to be on this side of the meetings. Usually I'm the one listening and learning from all the wonderful presenters that are often invited to this group. I wanted to talk to you a little bit more about what interpreting really has meant to me as a person and as a working professional. So I'm going to talk to you a little bit more about what that can look like, whether it's your job, your career, or your calling. So Yazmin and I want to spend some time sharing our own experiences, some anecdotes, the different ways you can navigate different spaces as interpreters. When Susan reached out to us to share a little bit more about those experiences, Yazmin and I had a long conversation about where we wanted to take this, what we wanted to share, because it's been a long journey for both of us. We agreed that we wanted to talk about the wonderful opportunity Tilde and Sensontle provided us, and also wanted to tell you about our day-to-day now with NCDHHS. So I took the liberty of pulling some old pictures together from a training that Yazmin and I participated in 2019. Now, when you hear 2019, I don't know if that rings a bell as pre-pandemic. But before we took on these new roles in our communities, we were both worker owners, Yazmin respectively in Tilde and myself in Sensontle. And so this training in April of 2019 gathered 24 language justice workers from the entire Southeast. And it really allowed us to become more familiar with language justice and the language justice curriculum that's shared by the Center for Participatory Change. It also allowed us to strengthen our toolbox, our relationships, and our resiliency. And little did we know we were going to be thrown into some really challenging times for our communities, especially those who are bilingual and really needed that advocacy and that gap in language access to be covered by the services and the efforts that we were providing. So the other thing, when I look at these pictures, there's one of the largest takeaways for me is that it showed me the beauty and importance of creating networks with those who were working on a similar path. It's so important to find that community in this work, both as a way to enhance our skills, but to get through the aspects of it that are heavy, that are challenging. And as we know on this call as interpreters, we often experience and witness a lot of that secondhand trauma. And often, frankly, injustices. And so I really want to take the space to look back at this time to reiterate how important it is that we have the tools to find a good balance between the work that we're doing, the careers we may have, and the passion that allows us to continue doing this work while taking care of ourselves and each other in this industry. This is what we learned that weekend in Tennessee. This is what I learned, and I would encourage you all to check out that curriculum. I'll be sure to share, Susan, a link to that to share. And also for fun or for edification, I would also recommend Se Escucha, which is a podcast that the Center for Participatory Change has. It's a podcast for interpreters that I've really enjoyed and has really enriched how I view the role that we all carry as interpreters. And as the previous presenters shared, we're community interpreters first and foremost, right? We have ethics, we have important roles, we have language aptitude, but I think for the work that we do day to day, we also have a lot of passion for those that we're able to help with these skills. So I want to share a little bit of that journey. I know Susan briefly talked about the different roles that I've held, but I thought it was important to share the different ways, angles, and intersections that your skills as interpreters can really take you to different spaces in your community, but certainly in my case, different roles. So I'll try to be brief because I know that, Yazmin has a lot that she wants to share about our day-to-day, but this is a good example. Fortunately for me, I was able to join the Vital Records Department and as one of my first jobs in Buncombe County back in 2017. And, at a first glance, you would think, well, how does Vital Records impact our community? Well, Vital Records is where you would go to either get a marriage certificate, a death certificate, register your deeds, or even try to get your birth certificate. We quickly identified one area that could really benefit from not just language support, but also culturally competent solutions. There were aspects of providing information for births, marriages, and even death certificates that were different for immigrants. Naming conventions, helping individuals understand how to fill out forms, the importance of included full names, no matter how long, no matter how many hyphens, no matter how many accents. This was really important. And I won't get too much into detail, but these errors that often were encountered in these documents often led individuals to amendment processes that were challenging, costly, and time-consuming for many families. So we began addressing ways to improve those systems and our ability to provide specialized support. A few years later, in 2019, I transitioned to work for our local sheriff's office, and there I encountered processes with law enforcement and victims that needed not just an interpreter. I know we've talked about legal court interpreters, but they also needed an advocate who could help navigate and better tailor those services. There were important aspects of building relationships and trust within the community, but also helping law enforcement better understand the growing community of immigrants they were serving, helping them, for example, understand why victims were hesitant to collaborate or seek support. It was more than bridging that language barrier. It was about building their cultural humility and understanding. And as we recall, we were quickly also faced with the COVID pandemic. And as the only bilingual communication specialist at the time, I was brought to the table to help find ways to inform our community. In Western North Carolina, where Buncombe County is located, there's no mainstream media. So it was quickly up to the health departments to diffuse information. I'm proud to share that we were able to provide simultaneous interpretation health briefings, and that we were able to have interpreters at the vaccination clinics, medical interpreters, and also send out mobile vaccination clinics to mobile home parks and other places identified by our community to be more accessible. We did this thanks to a team of local interpreters, both community interpreters, simultaneous interpreters, medical interpreters, and all of that made bringing this service and information to our community more accessible. After the years of COVID, we started to see events unfolding like Uvalde, and there it was evident that public safety and emergency management in other languages is vital during a time of crisis. We were able to meet with our school systems to help them ensure that this was taken into account and help us build in our emergency service processes what happens when you are met with a multilingual community. Who is going to call the parents? What is your, do you have a hotline? What is that plan for reunification with especially now our growing immigrant population? And so we did a lot of scenarios and walking through and talking about how we could better respond to those new needs and services. I could go on, but I really wanted to illustrate how the intersectionality of all of this work is so important. What today you may be thinking a career in medical interpreting or in the medical field looks like could take you into incredibly different directions. And I'm really glad that I have said yes to all the opportunities that I have been placed in the different areas of work, because I think that that really helps us understand why we all in our, they say it takes a grain of salt to, or like, one grain in the sand to fill the ocean. Well, I think that's true when we think about the different roles that we each do here on this call for our community. So this is really about crafting how we help others better navigate all those spaces that we touch day to day. And so, of course, when I heard that Yazmin's team was expanding, I wanted to help to be part of that larger system to help to improve the health and safety and well-being of all North Carolinians.
Thank you so much, Carolina, and thank you, Susan, and the Building Integrative Communities for the invitation to be part of this call today. And as Carolina mentioned, we talked a lot about what we wanted to share, and there's just so much. And I know that I'm the last speaker before we end, and I want to leave time for questions, so I'll be as brief as possible. I wanted to start just by sort of highlighting how Carolina's journey and my journey are very similar in terms of experience growing up in North Carolina, learning the language, connecting with a cooperative or being part of that development of language justice and language work in different parts of the state here in North Carolina. And so for me, looking at your presentation, Susan, I am what would be called a qualified interpreter because of the trainings and exposure to developing my language skills through tilde. And I also wanted to highlight, I do have a preference of simultaneous interpretation, and we can have a discussion later with people here on the call about just what feels right for you. And so, yes, as Carolina mentioned, I was a founding member of tilde and stayed engaged with them for a few years up until up until the time when I joined DHHS because of the extensive work requirement of this position. And what I wanted to share with you today about the work that DHHS is doing is sort of connecting and bringing full circle all the experiences and all the skills and the background that I have sort of gained throughout the last few years as being part of tilde, but also as an immigrant myself and the different barriers that I encounter navigating systems in North Carolina in terms of education, access to health, and various other systems. So here at the department, as you know, a lot of people really came to know the department with the response of the pandemic or the need to respond to the pandemic. And so the Department of Health and Human Services at the state, the mission is to collaborate with partners to provide essential services to improve the health, safety and well-being of all North Carolinians. And we can all recall where we were 2020 when the pandemic hit our communities and the need for communications and information in Spanish for the Latinx community that was disproportionately impacted. And that's when my role was created and I joined in January of 2021. So I brought a lot of those skills into the role and we can move on to the next slide. And so basically, I wanted to just kind of bring home a quick overview of the different ways that language comes into place at the work in the department for the jobs that Carolina and I have. We are really focused on making sure that information and resources are being brought to the community and meet them where they are in various ways. And for that work to take place, we oftentimes need to connect with interpreters, need to connect with translators, and we also want to make sure that we are including the bilingual and bicultural aspect to the work. And so here's just a brief summary of some of the things that we are involved in developing. We have a Noticias newsletter, we have cafecitos, and some of the work includes a lot of translation, but we also relied on the work of interpreters. So we work closely with Sensontle, with Tilde, with other agencies throughout the state to make sure that we're meeting the needs in the different programs that we have. So an example of that, Carolina mentioned that we were doing briefings, right? And so she was able to be part of that in the western part of the state. And here at the state level, we also had briefings with the Secretary of Health, with the governor, to make sure that people knew what was happening. And I do want to highlight that a lot of those efforts in terms of language really came to be because of the advocacy of community advocates and coalitions and Latinx serving organizations across the state that we were able to hear. Positions were created and the responses started from there. And so for the cafecitos, which I want to highlight, it is a Spanish language Facebook Live event where people have a chance to hear from subject matter experts, but also ask questions. And that whole event is in Spanish, but we do include interpreters because the team, the technical team on the background doesn't understand Spanish. And so in that sense, interpreters are part of the work that we're doing, but they are behind the scenes and might not be visible to the audience, but they're a very important part to make sure that we're able to do the live event in an efficient way. We also have a lot of other efforts that include like PSAs, Spanish media interviews that we might pay for, or it might be organic, as well as other meetings with community partner organizations. And so I wanted to mention those because part of the work is contracting externally with a lot of interpretation agencies. That is a lot of that's one of the main ways that we're able to bring interpreters into the work. But we have also been able to expand internally our workforce to make sure that we have more of those capabilities. So Carolina's position is part of those efforts. We also will be posting soon a part-time position for an administrative support that will require the person to speak English and Spanish. We have a bilingual communications manager in the comms team. We work closely with contracting agencies that have bilingual, bicultural staff and are able to help us with the PSAs and the different sort of communication efforts that we're doing with newspapers, radio stations, television, and so on. And we have also a translator team that is able to focus on health disparities and health equity subjects. And a lot of that did not exist before the pandemic and at the beginning, but we have been able to really sort of continue to improve and increase the efforts that we're doing to bring the information in a culturally competent manner and in Spanish. And I want to highlight this work because I would not have been able to do this if I hadn't had the background, the skills and the experience, and if I didn't know about really language justice and language access as a need for our community across the state. We can move on to the next slide, Susan. And one more thing that I wanted to highlight about our work and acknowledging that we have grown a lot, but also there's a long way to go. And that's part of the future, the current and future work that Carolina and I will continue to do here in the department. Something that is important for us is to continuously do assessments or evaluations of how things are going with the materials or the products that we're putting out. And so we recently were able to do an analysis of the Noticias newsletter, which goes out every 10 days or so, and Carolina manages the newsletter, developing that content. And we found out that the Spanish component is at a better literacy level than the English language. And so just to give you a little bit more background, for this newsletter to be sent, it goes through different sets of approvals and reviews by many people in the department, from the communications team to other colleagues. And so the translation team works on being able to create this in Spanish, and then Carolina and several other people in our team review the content to make sure that it is accurate, to make sure that we feel good about the language that we're including, and most importantly, that we're using plain language and that is at a literacy level that people can digest. So we're doing much better in the Spanish. We still have some work to do in the English, and that's because of where the content comes. And so a lot of work will be done internally to continue to improve on that sense. One more very interesting aspect of the work that we did during COVID, some of you might recall the vacunate.nc.gov website. We did find out that a lot of the people that were coming to the website were not only from North Carolina. We also had people that organically landed in our page from Mexico, from California, from South America, Central America, Texas. And so that happened organically because of the language that we were using, and that goes back to the cultural competency aspect. Either, you might be speaking like, verbally interpreting or translating, but that will continue to be important. And one of the main things that we did or started to do during COVID was to use the TU form, the informal Spanish, to make sure that we were as personal as possible and as familiar as possible in the language that we were using. And I know that throughout Spanish-speaking countries, different people use a different language. Some of them might prefer the usted, but that's what really what really drove this decision was the community feedback during the early days of the COVID response from our partners and advocates. So we listened and we made that adjustment. So most of our public-facing materials use the TU form. And we have so many other aspects of the work that were included in the previous slide, and we will continue to highlight, but I do want to move quickly to the next one just to make sure that we get through all the content. Part of the work also that we have been doing and that started during COVID was the creation of a small team that brought together language, communication, and physical access. And so this work group has really been driving a lot of the language access efforts along with other communication and physical access efforts that we've been doing since the pandemic. And so just to give you a quick sort of description of what we mean with language, communication, and physical access. Language, we're focusing on making sure that we are providing accessibility for people with limited English proficiency. In terms of communication, that we are aware of the needs of people with sensory disabilities so they can communicate and also understand, and that might include ASL interpreters, that might include plain language materials, and also physical access to make sure that people have access to those public spaces, buildings, and other facilities where resources are being provided. And so this work group came together as a response of COVID-19 because we were seeing a lot of the need in community vaccination clinics to make sure that they were accessible for everyone. And so a small but mighty team of 3 people came together, including myself, to develop resources for providers and for community-based organizations. And we were very lucky to get funding from the CDC, from a CDC Disparities grant, to be able to take our work to the next level. And what that really resulted in was in our ability to contract with interpretation agencies throughout the state to support community vaccination clinics. A lot of the events that we were able to support were through the affiliated efforts that were happening with the department, including community pop-up clinics, the farm worker health program that was providing vaccination clinics to farm workers, either at camps or at the point of arrival to North Carolina from Mexico and other places, as well as Healthier Together, which was a public-private partnership to make sure that we were reaching priority counties with high need for vaccination and low vaccination rates. and as well as the community health worker program, which some of you might also know about. So the numbers here are, I believe, from 2022, 2021, 2022. I forgot, they were somewhere on the slide, but we were able to reach, to support over 299 events with thousands of hours of interpretation support and reaching a lot of individuals across the state. And some of these numbers are estimates because as people were interpreting at the events, they were reporting this information after, but it was a little bit hard at times, especially in the farm worker. For the farm worker health outreach vaccinations, we had large groups of farm workers arriving at the time, so we were doing our best to make sure that we were capturing that information and serving them in the best way possible. And so part of the current efforts, a lot of this work, like I mentioned, happened during COVID. The end of the public health emergency came, thankfully. And so now we are at a place where we are continuing to work internally in the department to make sure that we are strengthening our efforts on language access, but also we have been coordinating or have started to coordinate community interpretation trainings where we will be partnering with a community-based organization in some of those counties where we had that relationship during the COVID response, to make sure that we are supporting and cultivating, developing the future interpreters that can be part of the community, and really take those roles that are needed, and encouraging them to either pursue health and human services as a bilingual worker or as an interpreter or in healthcare, but really providing them some of the training and support that might be needed for them to really see themselves as an interpreter. And this came to be really possible because of a lot of feedback that we heard from our partners during COVID and even after, about the need for more interpretation in communities, specifically in areas where there might be very low in resources. So we have the first interpretation training happening this Friday and Saturday in Alamance County at the Dream Center, which was a community center that provided FEMA vaccination efforts during the first stages of the vaccine rollout. And then we'll have one more happening in March in the mountains, and Carolina is working on that one with Unidex, another partner organization. And so depending on funding, we will continue to take the trainings to other parts of the state. We're working with different interpretation agencies to provide those trainings, and working specifically with those agencies closer to those regions to also develop those relationships. And it will be a community interpretation training. So it is gonna be more for to prepare those qualified interpreters, and hopefully they can move on to pursue other certifications if they are interested once they come through this training. And we can move on to the next one. And I know that I am at time, so I'll just run quickly to the next few slides. I wanted to highlight this, but mainly because I want to sort of elevate the efforts that have been done by the team. And we're a small but mighty team that has been really advocating to do more of that transcreation, which Carolina referred to. So it's not just translating, but making sure that we are intentional in the language and that we are also thinking about what will resonate with the community. And so last year we won the Spanish language Clear Marks Award for the summer campaign Un Verano Saludable. And rumor says that we were competing against the CDC and we won in Spanish. So that just makes me proud for the work that we have done, and sort of elevates it for the department to acknowledge and continue to support the need to really think about, the Latinx community and respond in a way that will resonate with the population. And we can move on to the next one, Susan. And this is the last slide. I wanted to sort of summarize what we have learned through this work And again, it brings together not just interpreting, but also translating, which is another important component of getting information out there. And additionally, Carolina and we brought, like I mentioned, our skills and our background into this work. And so we just wanted to sort of share that to inspire people, no matter where you go, as hopefully you'll, sort of dive into the interpretation career and path. But even if you don't have a role that has in your title interpreter, that advocacy and language that you have to make sure that we continue to elevate this need to create multilingual spaces, bilingual spaces, can really have an impact in whatever job you go into. And so for us at DHHS, this has meant really elevating the voices of trusted community members, hearing their feedback when it's good, when it's bad, bringing back the results and like involving them in the process, and making sure that we're working alongside them. Being able to center equity continues to be important because we want to make sure that we are culturally competent, and that you are not just creating content, but creating the content or providing that interpretation in a way that will make sense. And what I mean is, it's not just about providing interpretation, it's about making sure that people know that interpretation is available and conducting that outreach and creating those bridges so that those resources are actually utilized. Again, reviewing materials, being intentional of that, and continuing to expand, because there's always much more that we can continue to do to make sure that we're improving. And so I will stop there, and once again, appreciate the opportunity to share a little bit of the work that we have done and our experience.
Fantastic. Thank you so much, Yazmin and Carolina.